New at 5, newfound hope for kids born with congenital heart defects. Doctors at Arkansas Children's Hospital can now work on a patient without doing open heart surgery. THV 11's Mercedes McKay shows us why doctors are calling it a game changer.
Arkansas Children's is one of the first programs in the nation to do this procedure. It's a procedure that's not only changing the world of cardiology, but also the lives of over 600 Arkansas babies who are born with congenital heart defects every year.
And we're hopeful that it's going to be a good, long-lasting solution for them.
It's something that doctors like Michael Anchuaco have been waiting years for.
We've been looking over the past decade or so at ways that we can address heart disease in a less invasive manner without having to do open heart surgery.
Now that searching is over, and the answer is this: the Harmony valve. It's a replacement for the temporary valve that kids with heart defects receive earlier in life in a minimally invasive way.
We know that every time we have to go back in and repeat a surgery, it's a higher risk for something bad happening, a higher risk of death from the surgery.
The Harmony valve procedure not only decreases those risks, but also speeds up recovery time.
When patients come in for a valve replacement at my cath lab, they go home the next day and they go back to their lives.
Children's has implanted 6 of these valves so far, and Maddie Jacobs was one of the first. Her mom describing it as an answered prayer.
There's so many kids waiting on something like this. So they won't have to have another open heart surgery, because that's just traumatic for everyone.
Alicia Agarwal had to go through that with Maddie when she was just 9 weeks old. Even though no one would be able to tell on the outside, Alicia says before this procedure, Maddie was living on borrowed time.
I've been praying and praying for one of these valves to get approved. The Harmony was perfect for exactly what she needed.
While Maddie is now feeling happier and healthier, Alicia is hopeful for the future.
We know it's not forever, but hey, she's just going to get stronger and bigger and keep fighting.
In Little Rock, Mercedes McKay, THV 11 News.
This procedure and more is done in the hospital's new cath lab. Children's is the first pediatric cath lab in the world to have the newest technology, which includes things like 3D imaging and far less use of radiation.